Well, heart disease is the #1 killer of women and can strike earlier than you might think. Now is the time to make your heart health a priority. Here from St. Vincent's Medical Center is Dr. Joseph Tiano, the director of the Atrial Fibrillation Center, and his patient, Christopher Willie. Thank you all for being here.
Thank you for having us.
Doctor, I think you have to explain to our viewers what atrial defibrillation is.
Sure. Atrial fibrillation is a highly disorganized, irregular rhythm of the heart, and it tends to live in the left atrium of the heart. And it's different where normal sinus rhythm, which is our regular rhythm, lives in the right atrium of the heart and is one single wavelet driving the heart. AFib is millions of wavelets trying to drive the heart. So it creates a very uncomfortable feeling for the patient symptom-wise and places them at risk for a stroke, which is our main concern.
And it's fairly common?
It's very common. Probably we estimate 3 to 4 million Americans, but a lot of people tend to be asymptomatic, meaning they don't feel it or know that they're in it. So we estimate even higher.
All right. And Chris, you are a weekend warrior. You're an avid worker. You were constantly working out.
Right.
And you monitor your heart rate, which turned out to be really important.
Right, wearing heart rate monitors, teaching spin classes or just exercising. Noticed my heart rate would go real fast and slow down, then something just wasn't right and couldn't catch my breath. And so I spoke to my cardiologist because of a strong family history of heart disease. Put me in touch, Dr. Tiano, and purchased an app for my phone that could record an EKG. So when I wasn't feeling right, I would just record it and send it to him and say what's going on. And that's how he caught the atrial fibrillation.
Wow. And doctor, how do you treat this?
Sure, there's different options. The first option would be medication, which did not work with Chris. So then the second option, we move forth with something called an ablation.
Okay.
It's a simple procedure. We place an IV in a vein, and through that we place a wire up into the heart. And we can either use heat or cooling to get rid of the areas of the AFib. With Chris here, we use something called cryoablation, which is a balloon that freezes the area where the AFib lives. We're able to complete the procedure safely, and he did very, very well, and he's back to his training.
And you're spinning?
Spinning, swimming, doing it all. Yeah.
That's terrific. And you're still using the app, monitoring?
I still monitor once in a while just to make sure, if I feel funny, an extra beat here and there, but so far so good.
And when you say feel funny, what's off?
Just your breathing. If you exercise a lot, you get into a breathing rhythm and it gets short, or you just feel like your heart's racing faster than it should be based on the exertion that you're giving, and so that's when I felt off.
Sure.
Yeah.
And Dr. Chris mentioned it runs in his family. If you don't have a history of heart disease or heart problems, should we still be concerned?
You can. There's some classic risk factors such as hypertension, diabetes, heart disease, valvular disease, sleep apnea, obesity. So lifestyle is always important. And then there is a genetic component to it, but we're still trying to break that down to specifically find where to test.
And tell us a little bit about St. Vincent's for heart health.
Sure. So St. Vincent's has been an innovator in heart, particularly in your back area here in Fairfield County. We were the first for TAVR program, which is trans-aortic valve replacement. Ourselves, we started an AFib program about 5 years ago, where we're a center. We offer various options for ablation of AFib. We're a training center for larger academic centers that come to our center to be educated on what we're doing.
And this weekend, you are recognizing women in heart health. There's a walk. Tell us the details.
Sure. There's a great event this weekend at the Shelton Sportsplex. It's Women in Heart. Heart disease is the #1 killer in women, so we feel the need to help get that out there in public awareness and education. So there'll be some free screening, blood pressure, heart rate, BMI. It's just a fun event.
Good to know too, right?
Yeah,
Information
absolutely.
that you need. And Chris, just anything you would say to someone who thinks that they might have some sort of heart health history problem? Or...
Yeah, get it checked out.
Pretty easy, right?
Yeah, it's pretty simple. Don't ignore it because it can happen quick.
Sure.
And there are great treatment options. St. V's would be my #1 choice.
There you go. Well, thank you both for being here.
Thank
And you could check out stvincents.org/AFib for some more information there. Meg will send things over to you.